Hi, everyone who's joining. Thank you for being right on time. We will get started very soon. You are at CCIH's webinar, Equipping Faith-Based Health Systems for a Changing Climate, where we'll be talking about our new climate adaptation readiness assessment. And so we'll get started in a couple of minutes while we give people a chance to join. Thank you, Molly, for posting in the chat. If you want to start introducing yourself with your name, where you're working right now, and where you're joining from. I'm joining from very, very cold Chicago today. Molly's a little bit luckier. She's joining from Portugal today. Please do start introducing yourself in the chat as you join, and we will get started soon. If you have joined and are not an English speaker, we will be using AI translation today. CCIH uses Wordly, and I'll go over this a couple of times in these first couple minutes while people are joining. But we have been using Wordly artificial intelligence for a couple of years, and it's worked really well for these types of events. It provides written translation as well as audio interpretation. So if you scan the QR code, then you can listen to interpretation. So we recommend turning the volume down on your computer and turning it up on your phone so that you have simultaneous interpretation. If you're using it on your computer, when the Wordly site opens, you can enter the session ID, which is on the screen here, KQMU 4473. If you're asked for a passcode, it's 323579. So please use that if you would like. Even if you don't, if English is the language that you are using, it's often helpful to have that interpretation on in case there are any other languages that come up during Q&A or other portions. So feel free to use that or just check it out if it's the first time you've used Wordly. It's a cool service. Let's see, and the link is in the chat here. So I'll go over that one more time before we officially get started, but thank you for everyone who's joining right now. Please keep introducing yourselves in the chat. I'm seeing people joining, a few people joining from Kenya. Hello, from Liberia, New Jersey, Canada, Southern California, DRC, Congo, Georgia, Maryland, Cameroon, Nepal. Wow, we have a lot of people represented. Malawi. Excellent. It's wonderful to see all of you here. Well, keep introducing yourself. I'll just share one more time. If you need translation for the session today, we're using Wordly AI. There is a QR code on the screen. That's probably the easiest way to listen to the audio interpretation. So you scan that on your phone, turn the volume up on your phone, turn the volume down on your computer. If you want to see the written translation, open up on your web page too, using the link in the chat. We'll have the QR code on a couple more slides for people who are joining later, but it's helpful to have that up if you need translation. So I would like to get started because we have a lot to cover today and very exciting session. It's my pleasure to welcome you to this webinar, Equipping Faith-Based Health Systems for a Changing Climate. This is the official launch of our new faith-based climate health readiness and adaptation assessment. It is a mouthful, but it is a simple and practical tool to help faith-based organizations and local partners really boost their readiness and ability to adapt to severe weather disasters. So this resource, it just helps FBOs understand how climate change affects their work and helps them identify areas to strengthen resilience. I should introduce myself now. I'm Carolyn O'Brien. I'm program manager at CCIH. I've been at CCIH for a little bit over 5 years, and I am based in Chicago, and I am lucky enough to moderate this webinar today. For those of you that are new to CCIH, it's a global network of over 120 Christian organizations, as well as secular and interfaith partners committed to advancing health and wholeness. CCIH members work in over 90 countries globally, and many of those countries are represented here in this webinar. I'm seeing in the chat, that's really cool. These members include non-governmental organizations, church networks, Christian health associations, volunteer and product donation agencies, and other support organizations. So moving to our topic today, about 2 years ago, CCIH launched the Faith Consortium for Climate Resilient Health. If we can go to the next slide. We affectionately call this consortium Faith for CRH. And the goal is to increase climate resilience among faith-based health partners in low and middle income countries. 7 CCIH members and partners joined together to form Faith for CRH, including World Relief, World Renew, Providence, Mennonite Central Committee, Kupenda for the Children, Église Methodiste de Togo, and Chorus International. We released a powerful action statement when we launched 2 years ago. It was June 2024, that really oriented us around some shared goals. If we can go to the next slide. And as Molly posted in the chat, this is our action statement that I mentioned that we released at the launch of this consortium. And this, it goes into the goals I'm about to talk about, but also some objectives, some background, why and how faith partners should be involved with climate. And it was really cool rereading this to prep for today, because a few of our objectives are really oriented around providing the tools that faith-based partners need to adapt to climate. And here we are launching our first tool as a consortium today. Next slide. So our overarching goals are really, 1, offering a united voice on climate change adaptation through faith and by faith-based health actors, encouraging partnerships with the public sector as disaster response. The central piece of this, the heartbeat, is communication. How are different partners communicating and responding and working together? Faith-based partners are often first responders, and we want to make sure they're connected to all the actors and partners working on national and subnational local levels. Ensuring government partners understand the unique strengths of the faith-based actors and the ways they strengthen the whole health system, and creating momentum and action with local faith-based health actors on climate change adaptation. And this tool that we'll be talking more about today really hits that last bullet. We really want to create a platform for action and possibility and new ideas for action after FBOs have gone through this assessment and are ready to move forward into the action piece of this. Next slide. Okay, well, this is a little bit about me, but before I talk about and I introduce our other speakers, I just want to orient ourselves around, since Faith for CRH launched in June of 2024, we've seen a lot of extreme weather disasters all over. The top of my mind was Pakistan, who keeps getting hit over and over with monsoon floods. The last one took over 1,000 lives and displaced over 2 million people. Indonesia got hit with one of its deadliest floods in decades last year, with losing over 1,000 lives as well. Floods like these, along with droughts, excess heat, increased air pollution, are just some of the risks that result from extreme weather disasters that will worsen health if we are not prepared. And this tool is meant to help get us more prepared. Um, it's sad that US politics and other politics often get in the way of momentum for climate change response and slow our global capacity to respond. So we are just focused today on what FBOs can do and in the face of some of those political challenges as well. So our flow today, you'll see here, I am on the screen moderating this, but we have three awesome speakers as well. We'll get perspectives from a church leader, a Faith for CRH consortium member, and a climate and health FBO implementer. I'm happy to introduce Dr. Lana Manula, who's the health program lead for planning, learning, and disaster relief at Mennonite Central Committee. Next, we'll hear from Pastor Nenantu Romeo Blah, who's the executive director of the Christian Health Assistance Program Incorporated. Shorter is CHAP Incorporated. And then finally, we'll hear from Reverend Dr. Jessica Mormon, who's the president and CEO of the Evangelical Environmental Network. So looking forward to all three of these speakers. We'll be doing, they won't go right in order back to back. There'll be some back and forth. We'll do Q&A, and Reverend Dr. Jessica will close us out with some bold encouragements for church getting involved with this work. So looking forward to hearing what they have to say. So without further ado, I just want to take care of a couple of housekeeping things. We are in a webinar format, so we're asking to help keep us a bit organized. If you have questions as we go through this webinar, please put them in the Q&A box. And that's where we'll be pulling those questions once we get to our Q&A section. If you need or having trouble with the AI translation, please just write in the chat and our team will take care of it. And I think that's it. So without further ado, Dr. Lana, please.
Hey, good morning, good afternoon, and good evening to everyone on the call. Thank you to CCIH for having me today to share about Mennonite Central Committee's involvement in the Climate Consortium and how we plan to use the Climate Readiness and Adaptation Assessment tool. Next slide, please. So I'll start out by describing how MCC approaches programming with faith-based organizations in climate-fragile contexts. So at MCC, we describe ourselves as a worldwide ministry of Anabaptist churches, and many of our partners are churches and faith-based organizations, FBOs. So MCC recognizes faith traditions as sources of resilience, of trust, of collective action. And within our core values or our operating principles, we talk about MCC staff accompanying the church and accompanying other partners. And very often these are FBO, faith-based organization partners. Now, something that makes MCC unique is that we approach programming by working very, very closely with local churches and communities, often at a grassroots level. And this approach of localizing humanitarian action, it's been a core part of the way MCC works for a long time, for decades. So at MCC, we often say that we're partner-led, meaning that the programmatic work is designed by, directed by, and implemented by local partners, with MCC playing a supporting role, acting as a connector or a facilitator. So we work very, very closely with local partners and communities, supporting them step by step, listening, learning, and adapting together. So MCC works in over 40 low and middle income countries, and many of these countries are in climate fragile contexts. Now, because of our localized relational approach to programming, we can respond to extreme weather events and respond to climate risks in ways that are very locally owned and sustainable. And because our partners are so rooted in the communities, it gives them and it gives us a clear view and allows us to see how climate change is playing out in specific communities. So our partners are living and working in communities where they're already seeing and experiencing the impact of things like changing rainfall patterns, more frequent or intensified floods and droughts, stressed water resources, fewer harvests, food insecurity. And MCC's partners urge us to tell others how climate change is impacting their lives. So they see how their communities are being impacted and they know what kinds of responses will work in their contexts. So this approach allows for a contextually grounded response. In terms of what we work on, a lot of our projects focus on climate adaptation. So that would be supporting local communities who are finding ways to adapt to changing weather patterns in their area, providing training in soil and water conservation techniques, responding to water, sanitation, and hygiene needs, responding to healthcare needs of people who have been forced to migrate due to changing weather patterns, distributing emergency food and resources to those most in need as some examples. So in essence, MCC accompanies our partners as they lead context-specific, climate-sensitive responses that are rooted in local knowledge and values. Next slide, please. So now that you know a little bit about how MCC works, I'll talk about how MCC is envisioning the rollout and the practical integration of this tool within our programs. So we have already begun planning for a 3-hour mini course this spring, this May. The course will run during our annual, one of our annual internal training times. The course will be available both for our domestic program staff and our international program staff. So anyone working at MCC who is interested will have the opportunity to sign up for this course, learn what the tool is all about, learn how to use it. So this is the first way that we're planning to roll out this tool at MCC. Next, we're planning to pilot the tool with a small group of interested partners who already have capacity to take on climate resiliency elements in their existing projects. So as I mentioned earlier, a lot of our partners are telling us already about their experiences of the impacts of extreme weather events on their programming. So for example, we have a partner in Asia who operates a health facility that was badly damaged by mudslides. We have another partner in the Caribbean who operates a center that was damaged by severe floods. So as a next step, we're going to invite several of these partners who are already being impacted by these kinds of extreme weather events and changing weather patterns, who have the capacity to take on another element in their projects and try using this tool during the course of an upcoming project. After we've had a chance for several partners to use the tool, we would want to learn from their experience about what works well in terms of at what stage of the project cycle should the assessment be done? Can it be done well at a project level, or is it better at an organizational level? Those sorts of questions. So once we learn from the experiences of some of these partners who have used the tool, we would identify some lessons learned. And then once we've got those learnings identified, we plan to offer the tool more broadly to all of our partners as a resource alongside the other tools and supports that MCC offers in our accompaniment. Next slide, please. So to close, I just want to say a few quick words about the significance of why it was important for MCC to engage in this initiative and be part of this consortium. So firstly, at MCC, we have a focus on capacity strengthening for our partners. including our church partners and our FBO partners. So this tool offers a very clear, very systematic way for partners to reflect on and assess their current capacities, to understand their overall situation, to identify areas for growth. And for that reason, it's a very valuable tool for us. Secondly, it's important because MCC has a strong commitment to creation care. We care about climate change because we love God's good creation and we love people. So, as followers of Jesus, we have a responsibility to care for creation, both for today and for future generations. And at MCC, we say that reconciliation is at the center of our work and that we envision communities worldwide in right relationship with God, one another, and creation. So, for that reason, it's also important for us to be involved in this initiative. And then thirdly, sometimes there can be a bit of a conceptual gap within health programming in that those who don't have a strong background in environmental determinants of health, sometimes the connection between health and climate change may not always be immediately obvious. Now, this tool helps to bridge that gap. It sensitizes partners to the many different elements involved in climate resilient health facilities, like the need for clear communication, improved infrastructure, responding to changing disease burdens, healthcare workers staffing, continuity of care, those sorts of questions. So it's a really useful tool when the link between climate and health is not immediately apparent. So in sum, at MCC, we are already seeing and hearing from our partners that their work and their communities are being impacted by extreme weather and changing weather patterns. So this tool helps us to climate-proof MCC health projects, which will contribute toward building climate-resilient health systems and contribute toward well-being more broadly in the communities where we work. Thank you.
Thank you, Dr. Lana. That was great. Really cool to hear how MCC is rolling this out and how you're structured and how MCC partners are adapting to climate. Thank you so much. Please, if you have questions about what Dr. Lana presented and MCC's approach and their rollout, please put those in the Q&A and we'll address those in a little bit. Before we get to our next speaker, Pastor Romeo, I want to dig into a little bit more of the specifics of the tool. We just heard from MCC about their vision for how to use this tool, the big picture, what they're hoping for. How does this align with MCC's priorities? Now I'll talk a little bit more about the intricacies of the tool, how it works. And then Pastor Romeo from CHAP, they were one of the groups that pre-tested the tool. So they went through it and have some experience to share with us. So once we get a better idea of what the tool is and how it works, I'll pass the mic to Pastor Romeo. So just a quick note, who is this tool for? We envision it, as we mentioned, we envision it faith-based organizations using it, faith-based health facilities and networks, Christian health associations, community-based NGOs. We envision this being used with a multitude of different type of staff, program managers, leadership teams, boards, health staff, and then really there are faith elements. There are some key faith elements in this tool, but this can also be used by secular NGOs or even government partners because there's really the key elements of this are practical for any type of partner, local partners. So just wanted to mention that as well. Next slide. So how this tool works, you can use it in a few different ways. Like other CCIH tools, we created this in Excel so it can be used offline, it can be adapted. You can go through it all at once. You can go through it in stages. You can go through parts of it that are applicable. You can choose to not to do other parts. We recommend doing it with a small team. What we will really want to avoid is one or two people filling this out by themselves and then presenting the results to the team and then going from there. This should be a collaborative process involving lots of different staff and different conversations. Um, and it can also be used along strategic planning when you're creating a new strategy for a coming year or a couple of years. Funding for proposals. This would be a really cool opportunity if you're looking at some climate or agriculture or other environmental proposal to say, we're going to start with using this tool to really get an idea of our gaps and strengths and then focus on what we can do from there. So included in that Excel sheet, the first tab is some instruction, background, some things that are helpful for you to know before you start the tool. We have all the main parts of the tool. There's a scoring page. There's an action plan template, so how you can translate your results directly into action planning. And then there's a glossary. We know and we heard a lot of feedback when we were doing pre-testing and review groups that climate language, disaster response language can be quite confusing, especially in different contexts. And so we want to make sure to include a glossary so we are really, even though that it's going to be adapted in several different areas, that we're really unified in what we mean when we use different terms. Speaking of language, this is only available in English right now, but we have got a couple recent commitments, funding commitments that will allow us to at least translate into a couple of other languages initially, and then we're hoping to continue that forward as we move forward with this tool. Next slide. So I know I thought about screen sharing, but then that gets so small. I hope that you can see this, but if not, please do download the tool and take a look yourself. I think Molly has either put a link in the chat or will put a link in the chat. There it is right now. There are, let's see, there's 9 different domains, and those include leadership and governance, vulnerability, infrastructure, emergency response, health services continuity, community engagement and awareness, communication, and policy and advocacy. And each of those 9 domains has a few subdomains. They're all different based on what area that is. And then there's 4 key scores, 1 to 4, for different capacity levels. And so that is how the tool is organized, especially so this is a screen grab from the scoring page, so it helps you see everything closer together. The actual tool tab looks quite long and wordy, and that is because we wanted to be clear at every capacity level what is the indicator to be looking for to see if you're to measure yourself against the different capacity level, and then what is a clear example of that as well. If we can get to the next slide, I can explain a little bit more about how that works. So this is an example pulled from health services continuity with 2 subdomains there as well. So you'll see in the black font is an indicator or some sort of a measurement of what it would look like to be at this capacity, whether that's low, mid, high. And then in the blue font is an example, a practical example of what that would look like in real life. And so it's very wordy. We did try to cut it down, but we want to make sure that a lot of the times assessments, you don't know where to score yourself because, how is 2 different than 3? How is 3 different than 4? Where do we fall? We want to make it really clear. These are the levels that we're talking about, and that's how you can really score yourself, measure your organization for each of those subdomains. Next slide. So what can be gained by going through this assessment? I think I'm recalling now a few years back when CCIH was creating our comprehensive organization capacity assessment tool. We talked to a lot of FBOs that said, we're assessments out. Every donor asks us to do an assessment. We don't want any more. This is getting a little ridiculous, especially when it's the same type of assessment over and over again. But this is very unique in that we did a lot of background research. What tools are available, and what can we build from? And in this area, especially for FBOs, there wasn't much available. This is a really new and interesting type of tool. And so, number one thing you'll gain is really understanding your strengths, gaps, and priority areas for climate adaptation and resilience. It will help with planning and decision making. It will hopefully improve continuity of care. That is like a very key element of this tool. Hopefully support resource mobilization and advocacy efforts. So as I mentioned before, even going through this tool as part of a grant application or something like that would be an interesting way to utilize this, to maybe help mobilize some additional resources. Foster shared understanding and dialogue across teams and boards. So making sure that all of your organization or a lot of different types of staff are involved, that your boards are involved and oriented towards what your goals are in terms of adaptation and resilience. And then building stronger partnerships with government and other stakeholders. That's a huge key part of this as well. Building those communication channels, making sure those are strong, those partnerships are working well and mobilized during disasters when things are very chaotic and crazy. Next slide. Um, we want you to share your experience with us using this tool. This is a new tool. We did a lot of pre-testing and reviews, but now we have our version, I think we're calling it 1.1. And to get to 1.2, we need to hear from you all. What's working, what's not working, what's confusing. When you get in order to download the tool, you have to put your email in. That is so that we can follow up with you in a few months to see how are things going? Were you able to utilize it? What came out of that? Um, and that is so we are trying to plan ourselves. What are the next steps after this tool? How are organizations rolling this out? And so we're exploring a couple of different ideas, and the way that we move forward is going to depend on your feedback. Who's using the tool, and what are you all hoping after you use the tool with your action plans? So we are considering maybe sometime in September, October, doing a virtual learning exchange. So for any of the FBOs or partners who have used this tool to come together and share your experiences and share your ideas, share your action plans. We are also considering if we are able to secure funding, doing some micro grants. So for FBOs that have used it and have action plans, but need a little bit of funding to move forward with some of those actions, CCIH is hoping that we would maybe able to provide some small grants to FBOs who have gone through the tool. And then lastly, this last bullet, support is available. We have a generous climate health disaster response expert who's offered pro bono support for FBOs who are going through this tool or need help creating an action plan. So these are all big reasons to keep in communication with CCIH to let us know how you're doing, let us know if you need extra support, or if you would be interested in participating in some sort of a learning exchange. These are all ideas that we're trying to flesh out right now and are kind of bubbling up. So especially if you put your email in for the tool, we will be following up with more concrete ideas and plans for these things. But we're really excited that there's a lot of interest in this tool in helping FBOs prepare for what's for severe, the severe weather events that are continuing to happen all over the globe. So that is more about the tool, more about the plans for the tool and the rollout. Now I'm going to turn it over to Pastor Romeo to talk about CHAP's experience with testing the tool and what their staff thought, how they went through it, how they've utilized those initial results. So without further ado, Dr. or Pastor Romeo, please take it away. Pastor Romeo, you are muted and we can't see your camera. If you are able to unmute yourself and turn on your camera. Okay. You are now unmuted. I'm hearing some car horns in the back.
It's okay.
We can hear you
We-
now.
Okay now? Am I okay?
Yes, you are.
Okay.
Great.
Okay. All right. Thank you very much. So as I said, good morning, good afternoon to everyone, depending where you are. For us, we are grateful to the CCIH for being part of this discussion today. This is a great opportunity for us as health NGO, faith-based organization that is pretty new in Liberia. We have not gone too long yet. So we would like to share our experiences with this panel today on the discussion. So our key experiences during the pre-testing of the tools. So as you can see, please go back up the first star, please. Okay. No, the other one, the other star, the other. Go back again. No, from the start. Please go to the starting point. Go back to the slides.
Thank you. I think Angelica's
Are you-
trying to restart the PowerPoint here. Yeah,
Okay. So,
perfect.
so what we're saying is that when we got the tools in July after our involvement in the process, we decided to also share with our small management team the importance of the tools. So you saw that in the picture that we had there. That's what I was trying to show. So our experience is that during the pre-testing of the tools, the first thing is that we had community engagement. So we engage the community, our faith-based community, the churches that are within our areas of operation, and faith leaders. We engage them on the importance of the tools, and they were so excited because the discussion bring about on board, the moral and scientific, spiritual aspect of science into the tools, and they were so excited about that and welcoming the idea in these communities that we went to. But one key thing that came out was the issue of trust and cultural, cultural sensitivity as thing that we should look out for. Cultural sensitivities in the sense that we are talking about adaptation in the context of faith-based framing. How can they do adaptation? For example, if they were subsisting farmers in agriculture, and subsisting farmers require what we call shifting cultivation, moving from one area to the other area. And we are saying, no, you have to have care for creation. You have to preserve the forest. You have to make sure that the trees are all preserved. So in the context of the cultural sensitivity, how do we address that? So that was the issue that came up, and also the issue of trust. So these are the two key issues that stood out in the pre-testing of the tools. And then we also look at go into the area of practical usability of the tools. What was the best way to explain the tools to them in a language of that they will understand, the language that would be good for them? Because we're talking about science language and scientific terminology that were used in the tools. So how can we break those terminologies down to their level, merely in the level of faith-based understanding? And so that was part of the experience that we had. And that experience is that they were able to understand most of the things that we frame into faith-based language from the adaptation. For example, if we are talking about um, biodiversity biodiversity in a sense of scientific word, how can they understand it in a faith-based language? So these were some of the experiences we have, the practical usability, what was clear for them and what was not clear that we needed to simplify to their knowledge. And then we also have the experience in the context relevance. So we have so many communities, but all of these climate-related hazards are not common to all communities. There are specific hazards into specific communities. For communities that were in work in what we call the interland areas. For example, in Liberia, we have areas what we call the northern and central Liberia. And these areas they are prone to windstorm, hailstorm. Compare the
Mr. Romeo, if you could hear us, could you possibly turn your camera off for bandwidth? We're having some problems.
areas that we need to frame in a way that the specific context of the hazards they are faced with, context or relevance of the tools that we found out that during the pre-testing, community members or participants that they will not be able to get involved, to be equipped to do advocacy and to do other things concerning climate resilience. So we've realized that they lack capacity, they need knowledge, and they also need resources. So in the pre-testing, we also found out that there was area what we call the feedback loops. There were area what we call the feedback. How do we encourage dialogue between those of us who were who consider ourselves the climate experts and all those who were involved in the process, and then the faith groups and community members. How do we encourage them? We encourage dialogue with them, and we found that they help the process so that the tool will be very inclusive and actionable. Making the tool inclusive and actionable, it was through their inputs, through the dialogue that we have with them. So we move up to the next area of what is our general reflection overall for the pre-testing and the testing of the tools. So our general reflection is that the tools was more about bridging science and spirituality. It was not much about taking boxes. It was not about multiple choice, but bridging science and spirituality. And it shows that faith-based framing can make climate adaptation more relatable, motivating communities, faith leaders to act not just out of necessity, but to act out of responsibility and moral duty as well. So let's look at some of the insights, that we can share also with all of you. We talk about using faith as a motivator. If you see in the picture where we show the church, the local church under this the small reef, if you can see that, where we had the meeting with the local church, encouraging them because they have as faith as a motivator to respond more strongly when climate adaptation is framed into stewardship for creation and also for the moral duty. When they see climate adaptation is framed into the stewardship for creation, that this is not just about the pulpit, but it's also about the care for creation. God created even all of these things. God created the trees, God created the water, God created and they gave us the biodiversity, the ecosystem, and all of that before even created mankind. So we should also have care for that. And that is the issue of the insight on faith as a motivator. Then we look at, as we said earlier, we talked about the issue of local capacity or local context. It matters as well. The tools become more effective when we have specific climate adaptation, frame into risks for a particular community when it tailored to specific climate risks. So we realize that the tools is already framed to specific climate risks. For example, we talk about climate-related hazards or disaster in terms of flooding, drought, or epidemics, that are very common in our communities in Liberia. So we say, okay, the key is that how do we bridge science and spirituality? Because we are looking at science as a technical aspect of understanding the tools, and then the spirituality which comes from the biblical aspect. So how do we bridge the two? So we look at science mainly as data, the data, the technical data that we need, that will help us to be able to design, interventions in a way that will be sound intervention, that will be sound and also culturally relevant for the communities that we serve. So the challenge there now is how do we, collect the data and then develop the data for kind of intervention that we need. Because in our setting in Liberia, we don't have neither primary nor secondary data on climate disasters or climate hazards that are taking place over the last 10 years. So how do we find that kind of information? So that's one experience that we have. So then we already talked about capacity issues, capacity gaps. So we talk about community ownership. So how do they see, this process, to take ownership, to be duty bearer? And so the participatory nature of the tools, help, foster the dialogue more. And then that dialogue, in the process of the dialogue, the engagement, they saw that they also they are part of the process, they are part of the tools, and not just as a recipient, passive recipient of the tools or the knowledge, but they are also part of the process, and they should have ownership, and ownership is important. That will move the tools forward in a way that will be well implemented in the communities that we serve. So we talk about the policy relevance of the tools. So we are saying that all of the discussions, the different insights and inputs from these communities, the faith leaders, the churches, the community members that were mobilized, and we filter into national adaptation strategies. But the national adaptation strategies, we should ensure that they have the grassroots, solution or realities, in terms of the moral perspective of the tools. They should capture the grassroots, also realities, and not just the national adaptation tools that will leave out the grassroots realities. Because the people at the bottom are those that suffer, the worst situations when there are, climate disasters around in our setting. So we move, then we say, okay, so let's look at the significance of the tools to our work as Christian Health Assistance Program in Liberia. What made the tool significant to our work? The tool is significant to our work because the tool will strengthen resilience, strengthen community resilience. The tools help us in a way that our programming in terms of climate adaptation, and then with the health programming, how they help us to know that we need to integrate climate adaptation into our health programming. Before then, we didn't have the idea that climate adaptation needed to be integrated into our health program. So that is one of the key significance of the tools. Now we know that climate adaptation should be integrated into our health programming, which of course we are working on currently. And so we say faith-driven action. The tools is also significant because it's faith-driven action. By framing adaptation in moral and spiritual terms, whatever we call it, we were able to mobilize congregation and faith leaders, in these communities, as we're seeing in the picture, that they were able to see, climate adaptation as part of their stewardship and their service to community, and also stewardship and service to the service of God as well. So that is a faith-driven action that's so important. Then we talk about the evidence-based planning. Evidence-based planning provides structural assessment. We realize that the evidence-based planning that we started to do provide structural assessment. And so, as I said earlier, the issue of climate data, we now have the idea how to develop that, so that our intervention can have scientific information, scientific data, and also that are sound, and then also that will be culturally relevant for the communities that we serve. As I said before, the culture is a way of the life of the people. The people are used to shifting cultivation, even sometimes the role of gender, as we say, and all of that. So that is about the evidence-based planning we talk about here. So we talk about building partnership. So as you see the slide here, we are doing a presentation in terms of how do we presentation of different types of emergency. How do we bridge, government, NGOs, local faith organization, and communities to strengthen collaboration on climate resilience? How do we serve as a role model, as a bridge that will connect all these different groups, has CHAP incorporated. So that is one of the relevance of the tools. That has now positioned us to be able to be the voice, the strong voice within the faith community to bridge the gap we are talking about in terms of building partnership. So advocacy and influencing with the tools, we are now positioned to speak, with the strong voice that within the policy spaces, strong voice that show that how faith-based organization can contribute to national climate adaptation strategies. That is not just about, government is not just about the major or the bigger NGOs, the international NGOs, but has faith-based organization, grassroots organization. We can now speak with strong voice, that will change policy, direct policies in terms of adaptation strategies, national adaptation strategy. So we are saying, why was the engagement so important for us as Christian Health Assistance Program? Why was our engagement was important? It was important because
Pastor Romeo, I'm sorry to interrupt. If you can wrap up in just a minute, so we can so we can move forward. Thank you.
Thank you very much. Engagement was so important because we found out that the tools is in alignment with our mission and our purpose. The same purpose we have to serve vulnerable communities, to improve livelihoods of people that have been affected by climate disasters. And so empowering communities, how do we get involved in issues, services, and vulnerability population, often saved by CHAP, our organization, to have shaping, voices in all of that. So that's a capacity development. So as you say, so this is also part of the work that initially we started with. There's a group called the Youth Arrest in Liberia. We call them the Zocos. So as you can see in the pictorial, we mobilized resources and went to these sites and provided the services, care, medication and feeding for them, because these are neglected people all in the streets because the way they are being presented in society. So thank you very much for listening, and thank you for giving your time.
Thank you so much, Pastor Romeo. A lot of insights that you shared with us, but one that struck me the most was just how inclusive the process was for you all. I think one thing that's emphasized in the tool is that faith leaders, key community leaders shouldn't just be an afterthought during the response, oh, we need buy-in now from these people. It should be in planning discussions in the early stages. And CHAP took it one step further and said, let's involve faith leaders and community leaders in the assessment itself so that they really understand the gaps, that they have voice into those gaps, they have voice into the strengths, and it really kind of bridges the gaps from the start. And so thank you so much for sharing that experience, Pastor Romeo. We have gotten a few questions in the Q&A, and I see, Dr. Lana, you've been responding to those about MCC. Thank you for that, especially we're running a little bit behind. I'd like to answer just one question from the Q&A now, and then I'll hand the mic over to Dr. Reverend Jessica Mormon. And then I'll come back to the Q&A if we have time at the end. This webinar is intended to go 15 minutes past the hour. So we have time built in, but I know that some of you will have to leave at the hour, and I want to give you all a chance to hear the powerful words that Dr. Reverend Jessica is about to speak to us. So just 2 points of clarification before we get there. It looks like there was a little bit of confusion about, do I need to be connected to MCC or a member of CCIH in order to use the tool? No, the tool is open for anyone to use, any FBO or other partner to use the tool. It's free on CCIH website to download. We are just hoping that if you use the tool that you'll circle back to us and give us some feedback so that we can continue to improve and hopefully create maybe a group of FBOs who have used this first version to exchange some learnings and some action planning insights with each other. So that I wanted to make sure that that is clear. And then there was also a question about, is there video documentation to show how to use the tool in practice? We don't have that yet, but it sounds like, and it sounded like we even heard a little bit of feedback when we were developing the tool that a video tutorial may be helpful. So something we can definitely incorporate in the future. So thank you for that feedback as well. So I will circle back to the questions after we hear now from Dr. Reverend Jessica Mormon. Thank you.
Carolyn, thank you. And I just want to thank CCIH for your leadership in creating this incredible tool. And it's a real honor to provide some closing reflections today. I also want to thank Dr. Lana, Pastor Romeo, and truly everyone in the audience for your critical work to advancing the health and flourishing of people in your home communities and across the world. I cannot underscore how important this tool is in this season for supporting faith-based organizations to prepare to help and serve people in need when extreme weather disasters strike. As Pastor Romeo has already said, climate change affects our health, our livelihoods, and well-being, things at the very heart of Christian and faith-based mission. As Carolyn shared earlier, I am a climate scientist by training. I got into climate science because of my faith and as an answer to a call to ministry from the Lord as an 18-year-old. For these very reasons, the Lord led me in seeing this connection between climate change and the health, livelihoods, and well-being of all God's children, especially the most vulnerable. However, one of the many challenges we face with engaging folks on climate change and being prepared for those climate-fueled extreme disasters is we often think that it will never happen to us. Even as a climate scientist, I have found myself thinking the same thing. But 10 years ago, that changed. In November 2016, disaster struck the community where I grew up in East Tennessee, in the foothills of the Great Smoky Mountains. It was on the backdrop of months of extreme drought that an extreme wildfire was whipped up, something that in our neck of the woods we'd never experienced before, and frankly, we're not prepared for. 14 people tragically lost their lives, and thousands of homes and businesses were destroyed, including a family home of our own. Years later, on the other side of the mountain in Asheville, North Carolina, we tragically witnessed how there were no climate safe havens, as Asheville was once known, as dozens lost their lives in the Asheville floods. And we have seen this story play out in communities, towns, villages, and cities all across the world. As this relates to our churches, the question we must ask ourselves is, are we ready? Are we ready to receive and help community members impacted by climate-fueled extreme weather and other health threats? Because the truth is that when disaster strikes, folks turn to the church for help, whether we are ready or not. As churches, the question is, are we ready to receive them? Are we ready to help them, both in the immediate aftermath, but also for years to come? Because in the time of disaster, our local churches are not just the first in and the last out, they are already there and staying there for the long haul. This is Our churches are an invaluable resource for long-term, all-around community care and recovery. And again, it's so wonderful to see how Pastor Romeo involved local faith leaders there from the start in this process. I've spoken with many churches and pastors over the years who found themselves unexpectedly responding to disaster in their communities. And what they shared with me was that they weren't fully prepared. It wasn't fully on their radar. And even if it was, they weren't really sure where they would even start. And that's where I just want to say how important this tool is. It provides a proactive framework for churches, faith-based organizations, and other folks to kickstart these critical conversations, to think about aspects that they may not have thought of, and to contextualize this for their unique community and context. Today, I also want to speak to the importance of health partners and coming alongside churches to support them in this work. As health partners, you provide invaluable practical expertise, advice, and partnership with churches in all phases of disaster. Yes, in the disaster response and recovery phases, but critically in the preparedness and prevention phases as well. Because we don't only want to respond to disaster and environmental health threats, we want to prevent harm to the health and well-being of our communities from the very beginning. As health experts, your expertise is invaluable to supporting our churches to play their unique role in prevention and preparedness, in response, recovery, and resilience. And lastly, as health partners, you are continually on the front lines of witnessing firsthand how climate disasters and ongoing environmental health threats like air pollution and threats to wash harm the health, livelihood, and well-being of all God's children. Your stories and experiences bring the human face to climate change, taking it out of a scientific or political conversation or the prospect of harm in the distant future. Your stories and testimonies of defending and advancing health, of helping usher in life to the full for all in the here and now, especially for those most in need, are more important than ever as we face a season of setbacks and rollbacks to institutional solutions, tools, and resources available for all of us to address climate health threats. And so, in this critical moment, it is a critical time for the church to step up and show leadership. It is a time for you, as our health partners, to share your expertise and your stories. And it is for such a time as this for CCIH to resource churches, faith-based organization, and health partners with this important tool. So I encourage all of you here to explore how you can utilize this tool in your context to better resource and serve the communities that you are called to and committed to. Thank you again for this opportunity to share with you, and thank you again for your critical work in this area and in this moment.
Thank you so much, Dr. Reverend Jessica. What a nice word to kind of end our session and kind of close us and orient us after hearing from our amazing speakers and their experience. We all have a part to play. Churches, faith-based organizations, faith leaders, community leaders, policymakers. There is a piece to play for everyone in creation care and creating a future where people can really flourish. So we have about 10 minutes left. So I'd like to circle back to Q&A, and then I have a few closing things that I need to save a few minutes for. I wanted to address, and thank you to the speakers for answering a lot of the Q&A questions already, so appreciate that. There's a question from Rachel Taylor that is about climate data and evidence. And specifically, this question is for Pastor Romeo. What climate data and evidence were you able to access and use from Liberia in order to complete the tool? That this might help others as they move forward and complete the tool to understand where to pull some of the science behind what's happening and the data that can inform the results from the tool and even the action planning. Pastor Romeo, if you have any words to share on that.
Yeah, okay. As I said during my presentation, climate data is a challenge. We try to see how we gather the information on climate disasters, and then the data actually not available. So that has not been part of the tools. That was not part of the inclusiveness of the tools. So that is the challenge we still have. So that's what I said.
Thank you. I have heard that from other FBOs too. Getting that data and even accessing the national adaptation strategies can be quite complicated. So hopefully creating the stronger partnerships with government partners and others can lead to more accessible data and inclusive data there. So there is also a comment question from James Hospitales with Earth Medic, and I'm kind of wondering, James, if you wouldn't mind coming on camera and telling us about your experience and comparison with the PAHO WHO Climate Smart Health Facilities Toolkit, and what makes this a little bit different. If you're available, I know I'm a little bit putting you on the spot. If that's not going to work, let us know.
Hi, can you hear me?
Yes, we can hear you with a bit of an echo.
I'm not sure how to kill the echo. Yeah, thanks, Carol. Great work. And I served with the PAHO Disaster Response Team for many years. I'm also a person of faith.
I'm sorry, the echo is so strong. If there's a different audio option that we can try.
I'll try a different device. Hang a sec.
Yeah, I'm sorry. If there's any other reflections about that you'd like to put in the chat, I'm sorry we're not able to hear you very well, but I appreciate the partnership and collaboration with Canicom and with EarthMedic that we've been able to have so far. So thank you. Let's see. There is also a question here that for organizations that use this tool, do we see any improvements in trust from stakeholders that can possibly be mobilized for additional supports, especially from the government? So I don't know if any of the speakers would like to speak to that part, or even what you see as being potential for trust building, and how that can enable better partnerships with government. Pastor Romeo, I don't know if you would like to speak to that, or Dr. Lana. Sorry, Pastor Romeo, you're on mute, so we can't hear you. Can you unmute?
I'm mute, right?
Yes, we can hear you now. Thank you.
Okay. Yeah, I can speak to that. Yeah, so as I said, how do we engage government in terms of partnership support for the use of the tools for our faith-based organization and also the communities that we serve? It's about what I said earlier about advocacy and policy relevance, and then influencing as well. So we we as faith-based organization groups and leaders, I think we need to understand that this is important for our work, and so we need to move forward to get into advocacy and influences on government policy for government to see that this is important for the work of the communities in the country, for them to support such initiative. So because the issue of trust is also, we need to address that, whether government, we need to build trust with government as well, because sometimes the issue of trust is lacking, and they think that NGOs just want the money from government to just spend on the way they want to spend. So we have to also build trust with government through much more advocacy, through clear, objectives, through clear strategies that we can put forward, in terms of what we need to achieve.
Really well said. Thank you. Um, there's one other question here I'd like to address before we close. And while I'm addressing that, if the three speakers, if you have like a couple sentences you want to end with, some parting wisdom, that would be great. But there is a question, can CCIH explain how members are using the assessment tool in ongoing programs and what support is available for organizations to begin using it? So because this is such a new tool, we haven't heard back from members yet, but that is the goal this year in 2026. All of our Faith for CRH members will be kind of piloting it with their partners. Hopefully, many of you on this call will be using it. We want to collect that feedback, hear how the results can be integrated into strategies and planning and what action plans look like. And then maybe we will collect that info and put it in a brief or a blog and share it with our members and the CCH larger network. So that is what the goal is for 2026. I appreciate that question, and we're really hoping to collect some good feedback and stories that will help with even future implementation and maybe a version 1.2. All right. Well, I will go in the order that we heard you each, all of the speakers, to share like a parting word with us, and then I will close us out with some announcements. So, Dr. Lana.
Maybe I'll just circle back to that question about trust and increasing trust among stakeholders. As Carolyn said, like it's such a new tool that I mean, at MCC, we don't yet have any data or evidence on that, but I think that it definitely can increase an organization's trustworthiness to undertake, a very systematic exploration of where they're at and make the findings even available to other people in the organization or within the community. I think that could be an act of increasing the trustworthiness of a faith-based organization. And I think so. Thank you for whoever raised that, because that's just a point that just sort of comes to mind. Um, yeah, and again, like thank you to CCIH for having MCC be a part of this consortium. We've learned so much and we've benefited so much, and we're excited to continue to be involved.
Thank you, Dr. Lana. Pastor Romeo, any closing words?
Yeah, okay. Thank you to CCIH and this fifth committee. It's very, very important that I say thank you very much for the hard work. The tools is very important. It's more, framing the faith-based adaptation is more practical. It's not just symbolic. And so I urge that as faith leaders, as faith communities, we need to get involved into the process of reducing the impacts of climate change in our communities. Thank you very much.
Thank you, Pastor Romeo. And finally, Dr. Reverend Jessica.
Thank you. One of the questions I so often get asked is why care about climate change? And what we see here at CCIH is the answer. Because it impacts our health, it impacts the things that we already care about, and especially as faith-based organizations, the very areas we are called to serve and bring life to. So thank you, CCIH, for doing that and for contextualizing it for the faith community, which is an area where I truly believe we're going to see breakthrough in depolarizing this and getting down to the brass tacks of solutions by putting this back in the faith perspective and the human-centered reasons for addressing climate and bringing those life-saving solutions to bear.
Beautifully said. Thank you. Well, we are at time here, so just a couple of closing announcements, and then I will say a quick word of prayer to officially close out our time. If you want to stay updated with all CCIH climate related things, we have a Google group that is focused on this area where we send updates about what the consortium is doing and the tool. Molly will post that in the chat. Yeah, just follow that link and you can sign up to be part of that group. There will be a 2-question survey that comes up when you close out of the webinar. So please do fill that out because that helps us get feedback on CCIH events and this session in particular. And then lastly, we have our regional meeting coming up April 21 to 23 in the Philippines. And that is really focused on Christian partners working in health in Southeast Asia. That is an area that keeps getting hit over and over hard by extreme weather disasters. So if you're on this call and you work in that area, consider joining. We just opened up a late breaking opportunity to share posters. So check that opportunity as well. So I will pray us out, and then I wish you well on your day or your evening or having a good night's sleep. So without further ado, God, we are thankful that we have an opportunity to connect from all parts of the world today to talk about how we can come together to help our communities flourish in the face of disaster and continued stress from climate change. We just pray that you bring peace and strength and wisdom on how to move forward, on how to utilize this tool, or what conversations to have, even with different partners, with your church, with your family. Lord, help us take care of the earth that you have given us, and may we just be thankful for the blessings in our lives every day. Amen. Thank you all.